Hello everyone and welcome to today's session. We are going to talk about something highly relevant to both clinicians and patients, early stage chronic musculoskeletal disorders. In traditional Chinese medicine, these early stage soft tissue problems are often referred to as Jin Bi or tendinal muscular B syndrome. The term Jin refers to myofascial, the connective tissue structure that allow us to move, stretch, and stabilize our joints. These conditions typically begin after a strain exposure to cold or damp weather or poor posture over time. If they are not treated early, they can graduate developing into chronic conditions with symptoms like limited joint mobility, muscle stiffness, or even muscular atrophy. In modern biomedical terms, we are often dealing with things like myofascial pain syndrome, early frozen shoulder, or postural fatigue syndrome. These nagging soft tissue problems that don't show up well on scans but causes a lot of discomfort and functional limitations. Our focus today is to understand how TCM approaches these disorders before they are become irreversible, and how the formula called Jin Bi Fang can help restore function, reduce pain, and prevent long-term disability. Let's first explore how classical TCM understands the origins of Jin Bi. As the global population continues to age, chronic musculoskeletal pains has emerged as one of the most pressing public health challenges of our time. Epidemiological study shows a high prevalence of musculoskeletal disorders, particularly among middle-aged and elderly populations. These conditions not only cause pain and discomfort, but they are also major contributor to long-term disability, reduced mobility, and loss of independence in aging societies. Among the many causes of chronic pain, muscle tendon injuries and tendinous pain syndromes stand out. They are frequently underdiagnosed, yet they play a key role in functional decline, especially when not treated early or properly managed. Addressing this burden requires not only conventional approaches but also integrative strategies such as traditional Chinese medicine that focus on restoring movement, circulation, and systematic balance. Traditional Chinese medicine has long emphasized that the musculoskeletal pain often begins with external pathogenic invasion. The Huangdi Neijing teaches us that wind, cold, and dampness combines to cause B syndrome. This concept explains how environmental factors like cold and damp weather can enter the body through the skin and settle in the muscles, tendons, or joints, especially when a person is fatigued, exposed after sweating, or has a weak constitution. Later, TCM scholar Zhu Danxi warned us about the progression of unresolved B syndrome. He noted that if the condition lingers, it may lead to blood stasis, making the pain more fixed, stable, or chronic in nature. Other classical texts also emphasize the importance of qi and blood harmony in preventing B, as one famous saying goes, where qi and blood are in harmony, wind and damp cannot take hold. This means that a healthy body with robust circulation and strong Wei Qi is naturally resistant to external invasion. But when circulation is poor due to lifestyle, age, or constitutional deficiency, pain and dysfunction are more likely to settle in. These classical principles set the stage for how we understand and treat Jin Bi today. The treatment of Jin Bi has evolved over centuries, building upon some of the most well-known formula in TCM. In early history, formula like 四五汤 were adapted to support blood nutrition and soft tissue repair. 四物汤 is foundational for maintaining healthy circulation and nourishing the sinew. Later, in the Qing dynasty, physicians like Huang Qingren developed 桃红四物汤, which added blood-invigorating herbs like Huanghonghua and Taoren to more directly address blood stasis and pain. In modern time, Professor SHUTCM proposed a more integrated approach. He emphasized that in many early age musculoskeletal disorders, there are multiple layers of pathology, including qi and blood deficiency, external wind damp invasion, and meridian blockage. That's how the formula Jin Bi Fang was developed. It contained tonifying herb to support the body, moving herb to activate circulation, expelling herb to drive out wind damp, and meridian unblocking herb to restore mobility. The formula is a perfect example of how classical wisdom and model clinical understanding can come together. Let's now take a closer look at what inside the Jin Bi Fang and how each herb contributes to overall function of the formula. Huang Qi, this herb tonifies qi and strengthens the body exterior. It helps the body resist external pathogens and improves circulation to superficial tissues like muscles and fascia. Dangui and Chuanxiong, these herbs nourish and move the blood, supporting tissue repair and reducing pain caused by stagnation. Dilong, also called earthworm, earthworm. In TCM, this herb is famous for unblocking the channels and promoting movement in area with tightness or stiffness. Qianghuo and Qingjiao, these are key wind damp expelling herbs, especially good for the upper body and the limbs. The overall structure of the formula draws inspiration from 四物汤 for blood nutrition, 补中益气汤 for qi tonification, 生痛逐瘀汤 for pain and stasis, and 羌活肾湿汤 for wind damp obstruction. It's a beautiful synergy that balances tonification with elimination. So what makes Jin Bi Fang different from other formula? It follows three core therapeutic strategy. The first one is tonifying qi and blood to support recover and prevent recurrence. The second, expel wind and damp to remove lingering external pathogen. The third, unblock the artery to restore full function and relieve pain. What's innovative about the formula is that it balances support and attack. Many formulas are either too warming and moving or too nourishing and gentle. Jin Bi Fang does both. It strengthens what's weak while also eliminating what doesn't belong. A true reflection of TCM principle. 扶正祛瘀 support the upright while dispel the pathogenic. The inclusion of Earthworld Dilong along with Qianghuo and Qingjiao give this formula an edge to treat cases where the channels feel tight, heavy, or resistant to movement, a hallmark of early stage B syndrome. Now, let's look at what model pharmacology says about the herb in Jin Bi Fang. Huangqi have been found to boost immune function and reduce chronic inflammation, making themselves useful in degenerative soft tissue conditions. Dangui contain ferulic acid and other phenolic compounds which improve microcirculations, promote healing, and reduce oxidative stress. Taoren and Honghua, often added in case of stasis, help reduce platelet aggregation, improve blood viscosity, and reduce swelling. Important for recovery after sprain or strain. Dilong enzyme have been shown to have anti-inflammatory, anti-thrombotic, and then neuroprotective effects. This is great news for patients with nerve entrapment or chronic stiffness. Overall, these findings show that TCM principles often align with biomedical mechanisms suggested in different language, whether we set unblock the channels or restore circulation. The therapeutic goal is the same. Let's take a moment to appreciate how TCM theory has evolved from the classics to modern day clinical application. Zhang Zhongjing, the sage of clinical formula, emphasizes the dynamic interactive of pathogenic factors are internal weakness. His thinking forms the foundation for understanding B disorder. Li Dongyuan taught that the spleen qi deficiency allowed dampness and cold to penetrate more deeply, highlighting the role of digestion, stress in resisting musculoskeletal disease. Ye Tianshi from the warm disease school focus on how damp heat and stagnation affect the circulation and cause lingering pain. In modern time, Professor Shi developed the idea of trade behind the Jin Bi. The first one is qi blood obstruction, the second is zang fu imbalance, and the third and the last tendon muscle disharmony. This model helps clinicians make more nuanced decisions when adjusting formula, whether the emphasis should be on tonifying, dispersing, warming, or cooling. In recent years, Jin Bi Fang has gained support from evidence-based clinical study. For example, a 2022 multi-center RCT evaluated modified Jin Bi Fang for early-stage frozen shoulder. Compared with standard NSAID treatment, patients who took the herbal formula had lower pain score, improved range of motion, and faster return to function. Another study looked at acute lumbar strain, a common condition after lifting or twisting. The group using Jin Bi Fang recovered 1.5 times faster than those in conventional anti-inflammatory alone. This find give us confidence that Jin Bi Fang can help in the early reversible stage of chronic soft tissue dysfunction and may even reduce the need for long-term medication. So how do we apply Jin Bi Fang in the clinic? We follow a few key principles. The first one, tonifying deficiency, especially when patients feel tired, have weak pulses, or slow healing. Eliminate excess, especially in patients who swelling, stiffness, or clear sign of external dampness. And the third one is harmonized qi and blood, which ensures that movement reaches the muscle and the tendons. Modifications are more common. For heavy dampness, we can add 防风, 独活, or 苍术. For obvious blood stasis, herbs like 红花, 赤芍, or 丹参 can be included. If patients have qi deficiency with low back weakness, we can add 人参 or 白术. The goal is always the same: restore flow, reduce pain, and prevent chronic degeneration. To summarize today's session, Jin Bi Fang represents the early, often reversible stage of chronic soft tissue disorder. Jin Bi Fang is a modern formula based on classical theory designed to tonify qi and blood, expel wind damp, and unblock the meridians. The formula balances supportive and eliminative strategy, reflecting the TCM principle of treating both root and branch. Model research supports its use for frozen shoulder, lumbar strain, and myofascial pain. With proper differentiation and modification, it helps prevent mild injuries from turning into lifelong problem. As we say in TCM, when qi and blood flow freely, the tendon and the channel will relax. Thank you all, and I'd be happy to answer any questions. Thank you.